I would like to welcome you to this panel discussion. Welcome, Marti Moore. By the way, congrats on an amazing motor vehicle extravaganza that you always do when El Mes del Orgullo comes in.
Thank you very much. That's all Juan Moreno. He pulled that off. So proud of his work.
Awesome. Welcome also Lizbeth Mendoza. I already have had the opportunity to interview you in other aspects around vaccine also, and so I'm super happy to have the opportunity to catch up with you this time. I have not met Craig Towler. Is that how you pronounce your last name?
Yep, that's correct, Towler.
Okay. Welcome, and I cannot wait to hear from you. Who else is in the call? Nate, George. I'm happy that you are with us. And también, como siempre, el señor Jorge de Santiago. How are you, Jorge, from el Centro Amistad? This is awesome.
Rossna, ¿cómo estás?
Muy bien, muchas gracias. Bueno, I really want to be able to, respect your time and take this opportunity to interview you around everything that has to do with vaccine hesitation, vaccine hesitancy, and the reality that our communities are still not getting the vaccine. The numbers are showing us that we are still behind with the rest of the Anglo population in getting the vaccine. So my first question to you will be, why do you think this is happening, and what can we do about it? And Marti, yes, you can start first.
I was waiting for Jorge. Good morning, Jorge. There are a variety of different barriers. I think that we need to take a step back and think about not just the barriers that are in place once the vaccine became available, but the existing systems that keep people from accessing healthcare. So we had the LGBTQ community. I'll let Jorge speak to the Latinx community. But if you look at our numbers, we don't have relationships with medical institutions or doctors. So there's a lack of trust before we even fell prey to COVID. And then with the rollout of the vaccines being called warp speed, when members in the LGBTQ community have been living with AIDS, another virus, for 40 years where there's no vaccine, and we weren't represented as a community in any of the clinical trials, nor are we represented in any of the data in who has or has not been vaccinated. When the government systems talk about equity and leave out the LGBTQ community, so we don't know if we're being successful or not. We started behind the 8 ball, and in partnership with Boulder County Public Health, Craig from the Center for People with Disabilities, Teresa Garcia from El Paso, and our close community partner, El Centro Amistad, we began working as fast as we could in January when the vaccines became available to find the systems within our own county that are not built for all people. And we began putting equity clinics together to let our folks know it's a safe place to come with people like them there to get vaccinated. So I will stop there because I could talk all day about the systems that have created the reality that we are not vaccinated. And I bet Jorge has some things to add to that.
Sure. Thank you, Marti. I think, I'm going to second what Marti just mentioned. I think from my perspective, really working for the last, all last year and this last few months of 2021 with the Latino community, I think it's important to understand what Marti just said. Especially with the Latinx community, we have a lot of hesitant to really trust the systems. And several of these community members who have not been vaccinated right now, I think it's because there's still the fear. And I think everything came down when finally we came to a point where people were, yes, let's get vaccinated, but then the issue of the Johnson & Johnson vaccine, those side effects that were happening spread out rapidly, through our community, to social media. And so people start kind of getting scared. Not just to the Johnson & Johnson vaccine, to every single vaccine. Say, there you go. This is the issue that we were talking about at one point. So after the fact, that we know that all the vaccines are safe, the task to educate the community again, about vaccine has been really hard. But we get into a point where people understand that is the best option is to get vaccinated, especially families with children 12 and up. That's the focus that we have been really targeting right now. But it's still within that range, we'll say those teenagers, I have been talking to several friends who have teenagers between 16 and 19-year-olds. They believe that this is a conspiracy against them. So it's really hard to really getting convinced to get them to the door to the vaccine. So that really replicates a lot of the young population, because that messaging that is being shared around social media is very negative. And we have to counterattack those messages with a positive message from people who already got vaccinated. So I think working with our community members who already got vaccinated, get the testimonies and tell them, yes, I was afraid at one point. I didn't trust it, but through the equity clinics that I attended, I felt safe. So we need that connection again. It felt to me like when everything happened with the J&J, we got a setback like a couple months for some reason. And it wasn't just for the Latinx community. I saw it in general. Everybody got to stop at one point. So I think right now, our job as a community organization, community members from Boulder County, we have to continue really addressing the same issues that when we started like 6 months ago, but with the information really say that all the vaccines are safe. And we need community champions, not just community ambassadors. Our organizations are working really hard to get people to those vaccines. But you know what? At the end of the day, my neighbor is the one who is going to try to convince me, my family member. So we are trying to identify community members to become champions of the vaccines. We have to get them to be spokespeople for our communities, because without them, we're not going to be able to do this. And that's going to become very challenging. I think everybody wants to get vaccinated, but it's still a lot of questions around if it's going to be safe for me to get vaccinated. Is my children not going to be safe? So it's several questions that we need to answer. So I think the strategy needs to change and get them to a point that they can trust the systems, they can trust the vaccines, and especially that they can trust our organizations and our partnerships in our communities, that we can actually provide an environment where they feel safe, we can answer questions, and we can actually channel them to the right resources that community members and families might have.
Jorge de Santiago from El Centro Amistad talking to us about the need of getting our communities vaccinated. The numbers are showing that there's a low vaccination rate in our communities, Latinx communities, also LGBTQ communities. And we are facing this in a moment that soon the schools will be open and our young students will go back to their classes. And there's a talk around the variants that will be, even more dangerous for our young ones. And if they don't get vaccinated, we are heading towards a moment that will be very difficult. I would like to also open the microphone to Nate George to see if he has something else to add to this conversation today.
Jorge actually, I think, hit the nail right on the head. The Johnson & Johnson pause, though it was only just a matter of days in reality that it was paused, really backed up the work we did by a matter of months. So Jorge spoke about our equity clinics. I was at all of those equity clinics that we did. I've spoken to all kinds of people, and I've asked questions about why they're getting the vaccine, why they're not getting the vaccine, and how those two things kind of relate to each other. Frankly, the biggest reason that I'm hearing right now about people who don't want to get it is they're scared of the side effects. And that's something that Jorge touched on there too, is that social media just kind of fuels this negativity that goes up, and nobody wants to talk about, oh, I got a vaccine and it is saving my life, and it is saving my neighbor's life. It is saving the little old lady behind me at the grocery store. I'm saving her life, and I don't even know her name. What we hear about are the side effects that last, on average, less than 24 hours. So, it's kind of this trade-off, and trying to convince people that maybe 24 hours of feeling crummy is totally worth the life-saving things that are coming, and being able to get us all vaccinated now will prevent those variants, as you mentioned earlier, the kiddos going back to school. And it's not just even the kiddos going back to school. Life is resuming as we know it. There's no more masks wearing in most stores. People are out. I'm seeing picnics down at the local park. Families are out enjoying the sunshine. It's summertime in Colorado, and everybody's eager to get out and be with one another. And unless we're all vaccinated, that becomes risky, and we're going to see some of those variants pop up and reinfection rates begin to increase. So the more people that we can get vaccinated now, and sometimes that is the prompt, right? Is that if you get vaccinated now, the worst variants that are coming might not be nearly as bad. And so, we have a lot of work to do, and we're trusted organizations within our communities, and we're trusted to deliver honest and safe messages. And so for us to be able to come forward to our communities and say, these vaccines are safe, this is an easy process, we will be here. It's proven beneficial, but we are not being tracked. So it's hard for us to know exactly how many of us we've reached.
It is not an easy task. And, I know that there is that offer from the community. The vaccine clinics are available, but not everybody is registering. And it's hard. It's hard. A big effort, but it's not happening. The results are not the ones that we want. I also want to make sure that I go to Craig Towler, and I ask him about what is he seeing in, with a disability, people with disabilities, what are they experiencing when we talk about access to vaccine?
Hello, thank you very much. And yeah, just to echo with what everyone's saying, I think the biggest barrier that we're facing now within the disability community is access to information, and access to transportation, and access to actual physical clinics within our communities. And throughout this entire pandemic, when we've switched to kind of this digital world that we're in now and having this conversation on, it's left a lot of people from our community really isolated. And that's just not physically isolated, but isolated from access to information as well. So in regards to combating hesitancy in our communities, there's a lot of people that just aren't getting the information about how safe these vaccines are. So we're really having to refocus our outreach to a much more targeted response, where we're calling people, cold calling people, and going door to door, and word of mouth, having friends tell friends, and testimonials to help get the information to everyone, and then also in an accessible way to make sure that it's offered on accessible websites that are screen reader compatible. And we have large print guides and easy to read guides on all of our community websites. Just making sure that, because in addition to the hesitancy we're seeing, there's still a lot of members, especially in the disability community, that want to get the vaccine, but they're unable to because of various barriers that are in place. And it's our goal to really figure out who these individuals are, and then to help provide the resources that are needed to give them the access to the vaccine. And this goes from just helping with scheduling on the online formats, or helping schedule accessible transportation, or for a lot of individuals who, for whatever reason, some mobility needs, are unable to leave their homes, we can help get care and the vaccine delivered to their home and administered there in that safe environment. And those are just some of the things that we're focusing on, as well as everyone else on this call. We've been working so hard to get trusted education so people are making their decisions based on facts from trusted community members, and we're hoping to be that resource for everyone.
Thank you so much, Craig, for pointing out this thing about accessibility, especially when people are experiencing low mobility. Just like, the vaccine clinics that are drive-through, not everybody has a car. So when these clinics, these equity clinics realize that not everybody has a car, then they establish other ways of providing the vaccine. And now what you're talking about of trying not to wait for the people to come to the clinics, but going to where they are, it seems like it will be a great solution. I also thank you so much for what you have said. I don't want to miss out opening also the microphones to Lizbeth Mendoza, who I have had the opportunity to interview before. And, the knowledge that you hold because of the interpretation and the clinic experience that you have, I want to mention to you that through these last equity clinics that I have been able to attend, I have had the opportunity to speak with a medical provider who openly said to me, to KGNU community radio, that she's not going to get the vaccine. She has decided not to do it, and that she takes care of her body in a different way. I also had the opportunity in Orchard Grove to interview a gentleman who was outside his house, and he openly said vaccines are killers, and he in a way was holding the space and holding a card, a big sign saying vaccines will kill you. And this, for a community that is already fearful and doesn't trust in the government, was something really difficult to see. But this is the reality. This is what we are being exposed, not only social media, but people that are really choosing not to get the vaccine. What can we do about this?
Hi, thank you. Well, aside of all this, or on top of everything that we have heard, it's full of truth and the reflection of what people are saying from different sources, and including the research, the surveys that are being launched, and all that stuff. So this particular piece that you're mentioning, we do have that wall of the people who are anti-vaxxers, and they're not going to change their mind. And in the data, we know that is anywhere between 13–15% of the populations, either in the country or even here in this area. We are not really anymore aiming to break that wall. That is a wall that they decided that they want to have. They have their own perspective, their own framework, their own belief system, and that is something that we can't really it is not possible to cross with ours, because we have a completely different belief system. So we're not anymore trying to go that way. It is a problem, because then they are the ones who kind of like don't allow the hesitant people who are thinking, are trying to make a decision. They are having questions, and they are hearing myths, and they're being bombarded through social media with all these things. And they want to get vaccinated. It's just that they have to do that last step to the decision to make it happen. And then all these barriers come in front of them, so it makes it more difficult. And then on top of that, we have these people. So these people, we're not worrying, but we want to focus on our people, on the people who are thinking about it, that are considering it. On top of what we have heard, the piece of information I think is a very important one. I attended a clinic this Saturday, and people didn't know that it was free. There was people walking in saying, "Oh, this is free," and it's been like 6 months of saying all over, "This is free." they were like, "Ah, okay, if it's free, I'll take it." So that means that the information is not. That so simple piece of information is not getting there. How do I make it go very, very far? And I think one of the reasons is that the lack of access in their language, for one thing, or in the way they like to hear the things, in a way that is meaningful to them. Because again, just knowing about the free is easy. You can translate that message. There is not much to miss there. Free, gratis, different languages. But the other stuff that comes into the decision making, is this safe? Why do you say that is safe? Give me something that I can understand, where I go like, oh, that makes sense to me, then that is safe. And more now than ever, because it's about the kids. There are parents in a recent survey, parents, they vaccinated themselves, but they're doubting to vaccinate the kids because, and these are educated parents, providers, as you say, pediatricians that are like, yeah, I support vaccine and I got vaccine. Yeah, I will take the vaccine very soon, I'll do it. But still they're doubting because he's my kid, So I myself have felt sometimes doubt about the vaccine, not because of the vaccine, but because, taking my daughter to places without a mask, definitely not. Or when there are adults without masks that I'm like, I don't know if I want to leave my daughter here. And finally fall into the, hey, relax, the vaccines work. I know this for a fact. We got this. So all we have to do is trust now that the vaccines work, and that will give us a peace of mind to, in the case of us, but in the case of people who are thinking, what do I do with my kid? So anyways, just knowing that the vaccine works, the vaccines have great efficacy and efficiency. There's different terms in there, I'm sorry. But for instance, in the recent clinical trials that were for kids between 12 and 17, 12 and 15, they found 100% of effectiveness. That's even higher than the previous that we found. I mean, by 5%, but it's a lot. I mean, if you consider, if you fall in that 5%. So it's 100%. All of the kids that were included in those studies, in all of the kids that received the vaccine, there was no report of diagnosis through testing, diagnosis through symptoms, nothing. So that's like, it's huge. It's a huge finding, and now that they were authorized. But that's the thing, how do I communicate this to people? Even simple things like the materials that are published for the parents to read about the safety of the vaccines in their kids, they take time to get translated, and that's just language. Forget about meaningfulness, culturally meaningful. That takes another piece. So I think it's all of these things that we need to look at. I mean, what the communities are saying, this is so valuable to work with these representatives that are so broad, and also they're so close to our communities. And on top of that, what the science community is saying, how do we build that bridge between what we learn, the scientist community learn, the communities learn, the people who had experience learn, how we put all this together. And I think it's only by working together, by having all of us together, all these communities, the scientists, the physicians, the agencies that bring the vaccines, the manufacturers of the vaccines, because they also need the feedback. I mean, all of this, putting it together, I think is the only way we're going to be able to break the other wall, the wall of the people who are just hesitant. And there's different layers of hesitancy, but at least, try to cover that in a dream, like an 87% of community immunity, hopefully, if we don't take into account that other 13% of the people who are anti-vaxxers fully, there is not much more to do there. How do we do that? So I think it's only that.
How do we do this? How do we do this? And you have pointed out something important, together. And that's what I want to really thank you all for participating in this forum today. Lizbeth, Mendoza, thank you for pointing out this reality that we are facing. I want to make sure that we have Shannon Young, our new news director here at KGNU, and I want to allow her to ask you the final question to all of you. Thank you.
Well, this is to a point that Lizbeth made about how, people, even 6 months later, people don't know that the vaccine is free. And I think that those of us in the newsroom, we're rather voracious consumers of information. And sometimes we just lose sight that not everybody is on the same page. And I want to ask really everyone, how can those of us in the media, those of us who are communicating information, how can we do a better job to make sure that the message gets across in a way that's clear? And how can we help to dismiss or answer some of the questions that you're seeing with people who are hesitant?
I mean, one quick idea that comes to me is definitely the language to begin with, just to open. translating in as many languages, but make it super clear in the language, in Spanish, in English, in all these other languages that we have in the county. Free, gratis. Somehow in the commercial it has to show free. I don't miss that. It's available. You can visit. There's pharmacies, hospitals, people organizing in their communities. There's vaccination clinics. There's, walk-ins in Walgreens, Safeway, so on. Just that, not maybe we can say much about the safety, just emphasizing it's safe. The studies have been done, the review by the FDA has been done, by the committee it has been done. There's so many layers of review. They are safe and they're effective, they're free. And there are now clinics, afternoons, weekends, mornings. Please, do it. So we can go back to our activities and so on.
I think Lizbeth might have just summed it up best right there. Safe, effective, free. Those 3 words, those are the 3 words that we have to promote, and keeping it as simple as possible, and also keeping in mind that in writing as well as verbally, we have to be aware of our audience at the time. If it's in writing, not everyone is able to read, so we also have to provide that verbally as well. If you're providing something verbally, please make sure that you also have the ability to put it into writing. If for some reason the person across from you maybe reads lips and you are wearing a mask that is obstructing them, or perhaps you're on Zoom and you have turned your head this way and the captions aren't on, making sure those things are in writing as well. Those 3 words, I think, are the key driving points right now, is that they are safe, they are effective, and they are free.
And I just would like to add real quickly that in addition to that, it's really important to understand the audience that you're speaking with the information, because the universal messages of it being free are really good, but we could be speaking with an individual that goes, I know they're free, but I don't have a way to get there, or I can't leave my home and I need the vaccine brought to me. So it's really important to not only give that broad universal information, but also have access to resources. So if someone does have a specific need, we have the resource within the community that we can refer them to and help get the assistance that's required to remove these barriers. So I think that's really important too.
I would add to Craig's well-taken point, when the information came out about vaccines, folks talked about mobile clinics. Well, obviously misnamed. We don't have mobile clinics. We do not have a van that drives around to people's homes and gives those. That's a clinic that sets up shop somewhere that hopefully is accessible, but they're not mobile clinics. And I think, and it's expensive. So the vaccines are free, but the time, the energy, the supplies for the providers, that is not free, right? So there are these financial decisions being made by providers, which they have to, right? But if you're only going to see 30 people, we can't do it, right? And if we could see 30 people today and give them vaccines from the Latinx community, people with disabilities, or LGBTQ people, that would be a win, right? Something that just got to them and was done. So we're learning a lot in this pandemic, and we're always learning it after we should have moved, whether that be Out Boulder County, whether that be Boulder County Public Health, the CDC, name it, right? That what I always say, it's repairing a plane in flight. And so here we are again, trying to find the 20% that still remains that need to be vaccinated. And the LGBTQ community is diverse and no longer just lives in a neighborhood. So back in the old days, as a young dyke, you could knock on doors, right? Because we all lived in one area. But now we're in suburbs, we're wherever. And so we can't do a door-to-door approach to find people. And if people are not following a social media feed, if they're not following our newsletter, they're not getting the information. So Nate and I, our new job is to figure out what that system looks like. And I hope the providers are thinking about that too. I will add one more thing, since Jorge's not going to open his mic, is that Out Boulder County's youth program and El Centro Amistad's youth program are convening. And they are developing a survey, because one of the things that we do not have is information about what the barriers are for youth. Is it their parents? Is it, what is the barrier? And so our youth teams are meeting and putting that survey together with a soft mandate sooner than later, because to your point, around school reopening, we need to know what this information is, and we need to take it in, figure out what to do with it, and start providing for our youth also. So that's another program that we're currently working on.
Marti, thank you so much for saying this. It is super important, to the point that I was able to interview a young group of kids who were at Orchard Grove, and there was one kid who was hoping to get the vaccine. He was 13, he is 13 years old, and he waited and waited for the parents to come, and they never came until the end of the vaccine clinic when it closed. So that's to the point that, we have these barriers that if an adult is not with a kid, this kid is not going to get vaccinated.
One thing that I want to add is, from my perspective, at Amistad, we started in this week actually going door to door. When Marti mentioned, it's hard for her community. I think for us it's a little easier, but not really, because we have to go into communities where management, won't allow us to go and walk through the community. And mobile home parks, they will call the police. So we have to be very careful about it and really be strategic, because we want to know exactly what is happening with our community. We want to ask three to five questions. Make sure they are already vaccinated. If they're not, why? What is the barriers, and what can we do to help them? And provide the information that we have already in all the clinics who are available, to see how we can actually help them access. And if we don't do this, we will know exactly who is actually vaccinated in our community. So the team of promotores actually starting this week, every afternoon, going to the communities, start knocking on doors and asking those questions, because in businesses, because if we don't do that, the face-to-face makes a difference. We're not going to convince them to do this, but we're going to provide information and answer questions right there that they might change their mind. And if they have further questions, we can actually connect them with a provider. With the clinic, we have a partnership with the People's Clinic and Family Health. So we want to make sure that they have the resources available. So I think to the question that Shannon asked, you already have the open mic providing information to our communities, but in this case, the Latino community receives information from different sources, different radio stations, different social media sources. So it's hard to make sure that they're receiving the correct one. So the only way that we're going to be able to get them to get to them the right information is by knocking on the doors, give it to them, introduce it yourself, and say, hey, we're here to support you. And that's pretty much how community organizing really, you mobilize people around. So we waited, and I think this is the time right now, because we see that all these clinics available, nobody's attending those clinics. So we want to make sure, why? Is all the people vaccinated or what? Hopefully they are, but I'm sure they're not. And making sure that they feel trusted and they feel supported as well to go through the systems. And so I think that's the best strategy we have to do. Now that we have that 20%, start knocking on doors, and whatever we have to do, afternoons, night, weekends, we just want to make sure that they know that it's vaccine clinics, equity clinics available for them.
Jorge de Santiago with el Centro Amistad. I'm just going to Spanish as soon as I look at you, and you have a point. That is knocking on doors. Always the work with our communities is one-on-one. It's a much more, time consuming, but that's the way it works. And you are really good at doing that. You have shown in other cases that that's the method, and that works really well for the community. Thank you.
Shannon, I just want to add, if you're okay with that, You can add to the, whenever you spread information, any questions, any doubts, like what Craig was saying, issues with transportation and so on, they can feel free to call in the call center of Boulder County Public Health, because there's, the team is now spreading questions all over, and we can try to find solution, including, transportation. What do we do with transportation? Jorge, for instance, in the case of Jorge, they can connect with, I think, with People's Clinic. We can connect with Clinic and Salud to help people with the specific needs, including people that normally faint because that's another one, faint when they go to get a vaccine. So then they need to be in a specific place, not in just any clinic, because they might need that help. So we can help them connect with what they need, but also, the case of kids with disabilities and autism recently, we just detected that. We can help them connect with resources too. So you can include the phone number of the call center for Boulder County Public Health. And some of those questions are gonna go to me and some to the research navigators, and however we can help. We may not have all the answers, but we'll try. And if anything, Jorge's here, Marty, Craig, so that if, just spread, these are the needs, these are the questions, who can help to solve this issue? Because then again, it takes all of us.
Estás en mudo.
Sorry, I'm trying to clean it. Lizbeth Mendoza with Boulder County Public Health. Thank you so much for what you have pointed out. It's really about coming together, and I see that you are all mobilizing to really provide the vaccines that are needed for the community. I want to thank you so much for allowing me and Shannon to run this panel discussion with all of you, and thank you again.
Thank you. Well.
Thank you. Thank you for organizing this.
Thank you.
Thank you very much.